Hi everybody. Things are starting to look better now in Ohio. We're going in the right direction. So I'll fill you in on some details coming up for us at least. First, I want to thank a number of people. I never realized in our practice how many people are involved with the public and have become infected with this SARS-CoV-2, the coronavirus. And some of those people actually have COVID-19. And I didn't realize this, but we have respiratory therapists that are parents that come to us. We have first responders, EMS, firefighters, police. We've got a lieutenant commander in the prison system, nurses and doctors. And they have actually become positive and become infected and have COVID-19. So to those of you, thank you for doing your job. I'm sorry that you got infected because you did your job, but we hope you have a fast recovery, and thank you very much. Listening to the governor of Ohio, it sounds like May the state will start to open up a little bit. Now, what that means specifically for us, I can't tell you, but I don't think things are going to be like they used to be. So here in the office, at least in the outpatient setting, I don't think we're going to shake hands anymore. There aren't going to be any more hugs. There probably will not be a waiting room where people will be milling around. The toys will probably be gone, unfortunately, and we'll have to find a different way to approach things. Now, how do we approach things now as we emerge? There's a perfect world, and then there's a realistic world. So in the perfect world, we would not get infected at all as we took care of everyone, and we wouldn't in turn infect you. And in the perfect world, this is what we should be wearing. This is called a hazmat suit. We should wear this between every contact we have with a human being where we're physically close or touching them. Then we should take this off and throw it out and move on to the next patient. That's the ideal world. That's not very realistic. So we have to come to some middle of the road. And how can we take care of your children but still protect them and protect us? Because we want to protect you, that's our job, but I also have a concern that I don't want our people here getting infected as well. So I think what we're left with is what we've already been doing, just making it a little bit stronger here. For years, our nursing staff, Heather and Leah and even Kathleen, we've been wiping down and disinfecting tables and chairs prior to and after your visit here in the office. So we've been doing that for years with a disinfectant. We've stepped it up with a bleach now. But that practice has been in place for years. We have sinks with soap and water, and we have hand sanitizer in every single room and in the hallways. And our rules have always been for years now, you wash your hands prior to touching your child, and we wash our hands after touching your child, so we're clean. We really can't wear these hazmat suits. It's not realistic. They're not enough, and you can't throw them out. Nurses are wearing garbage bags right now taking care of COVID-19 patients. So for us to think we can wear this outfit is unrealistic and then throw it out 30 times a day. Can you imagine your 2-year-old as we approach him in this suit? You think that's going to fly? You think he's going to be happy to see us? So it's not going to work. I was measuring our exam rooms, and it's actually 6.5 feet from the chair that we sit in when we talk to you and where you sit. So we actually already have social distancing when we talk to one another. We already wash our hands before and after. The rooms are disinfected before and after, so the contact areas are clean. So we're already doing all that. The problem is, or the challenge, how do you examine a human being and touch him and stay totally protected? And it's virtually impossible to do that. Even if you had a mask on, you'd have to throw that mask off after each interaction to make sure it doesn't get contaminated. If you wear the same mask all day, you'll probably contaminate yourself somehow, or at least the mask, and when you touch or rub or scratch your face or itch your face, you'll contaminate yourself and someone else. So wearing the same mask is not practical. So what we're left with is this, is when we start opening up in May, is there probably won't be a waiting room. You'll come from your car directly into the room. There won't be any milling around or interaction with other families. There won't be interactive toys. We won't be touching you. You won't be staying long. There will be limited physical contact during the exam with our hands washing before and afterwards. The only way I can put this into perspective is for you young whippersnapper parents, you won't remember this, but there's a movie called E.T. when he gets examined, and this is what keeps popping in my head. So that's the extreme of what we would have to do to protect you. The approach to E.T., the extraterrestrial, which I'll show you this brief clip, but that's not realistic. So what we're going to do is reinforce what we've been doing and then pare back the contact a little bit. And then I can keep you updated on details as we move forward. But at least we're emerging from this. And now I'm going to show you this little clip here. Hazmat suit. Whole bunch of hazmat suits.
Leave him alone. I can take care of him.
Put a Doppler scope in here and set me up for a 2D cardiac echo.
Cardiac echo.
He's not perfusing at all. He needs inotropic support.
Inotropes.
7.03. He's got a metabolic acidosis.
Metabolic acidosis.
It could be sepsis.
Sepsis, yeah.
We've drawn 2 sets of blood cultures.
He
Good.
needs broad spectrum coverage. How about amp, gent, and flat?
How about amp, gent, and flagell? So they think he's septic, which means he has a infection with bacteria, and they're going to put him on triple antibiotics. But I'm looking at him thinking, how do you start an IV on this thing? Okay, anyway, that's it, folks. I'll keep you updated. In the meantime, stay home. Stay home. Anyway.